Right. Okay, welcome everybody to the November 8th Human Services Committee meeting. Call to order now. First order of business is the approval of minutes. Do I have a motion to approve the minutes from October 18th?
So moved.
I'll second.
Second? Okay, all in favor?
Aye.
All opposed? Motion carries. Is there anyone here for the privilege of the floor? Seeing no one, we will move to our first proposed resolution, which is to amend the Chautauqua County Department of Mental Hygiene and Social Services 2023 budget for increased safety net costs. And I believe we have an amended, this is amended, that you didn't get in your packet, the amended proposed resolution is on the desk.
Yep, good evening. Sam Zafuto, Fiscal Supervisor for the Department of Finance assigned to Social Services and Public Health. This resolution is to amend the budget for safety net cost. It does have one that is amended through substitution. Initially, the original resolution was put together for October pre-file, but did not make it through the approval process, which is why the change. And with the benefit of the full October numbers and first week of November, that resolution would not have been sufficient. We do need additional funding based on what we're seeing and where we budgeted for 2023. We had a budget of $5.5 million, about $435,000 a month, and we're coming in over $700,000 a month currently in safety net costs. So this resolution is using fund balance. It is also reducing some of the savings from vacancies through social services and increasing the revenue from the state and federal government for safety net costs for the remainder of this year.
Any questions?
Yes, I don't know which one I'm looking at now, but
The one.
so my question on the original one was, why is it projected to be below budget? Is that question appropriate for the amended one?
No, the one was an increase of 1.7 million. Now it's an increase of 2.9. That's that strike through.
Okay. Okay, I guess I still have the same question. Why is it projected to be below budgeted amount?
It's not. It's projected to be significantly above.
Okay. Then
Yeah,
why
the
does it still
initial-
say that in here?
I mean, at the top it says projected to be in excess of budget, and then everything's an increase.
Right.
I guess I don't understand the question.
Yeah, the first whereas is to be in excess of budgeted amount. And then we're increasing the appropriation account.
Okay, thank you.
Oh, no problem.
Mr. Pavlock?
Sure. Thank you.
No problem.
So we're using a total of $1,207,000 of excess employee unexpenditures, or we haven't spent, right?
That is correct.
Okay. And then also we are using $894,000 of fund balance, correct?
That is correct.
Okay. So if we didn't have that savings, it'd really be all pulling from the fund balance.
With the exception of the increase in the revenue of the 28 and 1%, that is correct.
Understand those two categories, and that's so it's just like to make the point that it's a reason that we do like to have a decent fund balance to fall back on, in a sense, because just like this, we're really utilizing a lot of fund balance here, and this we projected next year an increase, but to what extent, and are we accurate with that?
The increase is projected from a 5.5 to almost 7 million next year after the budget hearing. So that's going to be very, depending upon the trends and what we're seeing currently, it's going to be very close next year. And again, that's depending upon a lot of economic and social factors is whether or not we're going to see this trend continue. We saw August go down, September slightly go up, but then October we went back up even further, and then the first week of November we're basically on track for 800,000 for this month again as well.
Does this pretty much chew up all the personnel's overages that you're gonna have in the
Yeah,
department?
not all, but pretty close to it. I didn't want to amend further, just in case, because we do have a lot of people working overtime and et cetera because of the vacancies, so, but it does take up the majority of that, yes.
And I just wanted to make the last note is, next year we are anticipating this savings already.
Yep.
So if this was an instance that we would really use more fund balance too.
Yeah, at that point, I would not have the vacancy savings to include in the resolution.
So, okay, thank you.
Do you know why it's increased in October?
Well, it's kind of stayed in the same, so the budget amount for this year really was kind of off, because even last year, we finished at almost 6.6 million and budgeted 5.5 this year. So we've been around 700,000, but October finished around 800,000, so that's all run through the state system in cases that are opened, so it's the need of the community,
It's
basically.
just the economic and
Mhm.
social factors.
Yep.
Any other questions? Concerns? All in favor of these? Oh,
You would need to make that motion to amend.
okay, I'm sorry, yes. We need a motion to amend by substitution for this corrected increase from 1.7 to 2.96.
So moved.
I'll second.
Second. Is there a motion, or is there, all in favor of the amendment?
Aye.
Aye.
Okay. I guess we should discuss it. Is there any discussion on the amendment? Okay, all in favor of the amendment?
Aye.
Aye.
Any further discussion on the amended motion? All in favor?
Aye.
Motion carries. Thank you.
Thank you, have a good evening.
Okay, our second proposed resolution is to amend the 2023 mental hygiene budget appropriations to account for increased costs associated with mental hygiene law 43.03.
Good evening, Carmelo Hernandez, Director of Mental Hygiene and Social Services. This is the infamous 730, and I pulled a lot of research together. It just so happened that I was at the DCS conference, and this was the hot topic again. We're going to be meeting at the IOCC next week with Albany, but we were able to put our numbers together. Majority of the counties were able to submit it last year compared to this year. And some counties are the same size as ours, some are bigger, some are smaller, but the data is unique, and I thought it was important for us to even know that here. It was news to me just to hear from the other counties as well. So in 2022, Albany, 1.3 million. This year so far, 900,000. In Cattaraugus, last year, only 500, and OMH was $591, but this year 175,000 already. Cayuga, 130,000 last year, already this year 125,000. We have Chemung, 256,420 last year, this year already at 317,000. Shenango, 33,870 last year. This year they're already at 250,000. Clinton, 280,491. This year they're at 50,000. They're actually doing pretty good this year.
Why?
That's a great question. They're actually doing pretty good this year. Delaware, 1,200 last year, 49,400 this year. Dutchess, 1.3 million last year. They're at 1.4 already this year to date. Erie, $3.5 million. This year they're at $4.2 million. Essex, $174,000 this year, $250,000. Franklin, $0 last year. This year, $700,000. Genesee, $182,000 last year. This year already $336,000. Green, $52,000 last year. This year, $132,000. Herkimer, $1 million last year. They didn't report yet this year. Jefferson, $0 last year, $175,000 this year. Montgomery, $178,000 last year. They haven't submitted their numbers yet this year. New York City didn't submit. Oneida, $4.6 million last year. They didn't put their number yet for this year. Rockland County, $1.5 million. $1.598 million last year. They're already at $1.5 million this year. Sullivan, $732,000 last year. They're already at $750,000. And Warren, $290,000 last year. They're projecting $500,000 this year. They're at $300,000 right now, but they're projecting they're going to finish the year at $500,000. Westchester County, $3.5 million last year. Already year to date, $2.5 million. Wyoming, $507,000 last year. They're at $1 million already this year. So this is a good just indicator of what's happening across the state with the 730s. We did speak with Governor Hochul's. I don't want to say they're in her cabinet, but they were one of her lobbyists, I guess, or advocators, and we spoke about the 730s, not just so much on what the price range is and how we are responsible now for 100%, but also the restoration piece and the belief of what is restoration, how people could be restored and be able to be a part of their defense, however, could still have active hallucinations and or be delusional and be on their medication, which is completely fair for us. And this is us, and we only had 4, which is it's the length of stay, which is also important to know, which I found out at this conference as well. Next year they're going to raise the price 14.7%, which is completely mind-boggling to me. And the question that we proposed at the conference was, let's say none of our counties sent one person, who would pay for the hospital and the workers that are there? Where would the money come from? We didn't get a straight answer on that one, so now I'm hoping to get one next week. For us, January, we would build $34,105.89. February, $30,805. March, $34,105. April, $62,710. May, $68,211. June, $70,412. July, $68,211.78. August, $44,007.60. September, $93,253.64. We're projecting that October would be $68,211.78. November, $52,809.12. And December, $34,105.89, which is $155,126.79. And then we had a young man OPWDD case that did, for the last 3 years, 0. A lot of the counties the same thing, 0, because there are no beds. This young man, unfortunately, I shouldn't say unfortunately. Fortunately, we were able to get him placed. Unfortunately, we got to pay 100% of the bill. And we just got the bill. They didn't keep us up to date on it, and I had a call with OMH on it, and we're projecting his total to be $72,666.45, which brings our hospitalization grand total of, with the last 3 months projection, on top of what we've been billed, $733,618.13.
So, how does that compare to this 500,000 then? What does that mean then?
The
You need more?
Yes. We're projecting this year our grand total to be between just the 4 730s that have been in the hospital and the one young man for the OPWDD to be a grand total of $733,618.13 that we have paid year to date on the 730s, $229,939.71. We have yet to pay on the 730s alone $275,885.18, and we're expecting the last 3 months $155,126.79. We're young man in the OPWDD. We just got that bill, so we haven't even paid anything for that bill.
So does that mean we need an amendment on this amount?
Yes, and I believe the amendment that we're asking for, I think it's 500,000, if I'm not mistaken.
We don't need an amendment.
The amount
The
that
amounts?
you have on here is adequate, the 500.
The
Yeah.
500? Okay.
Mhm.
Whew. Now, all of those counties that you listed were through September.
Yeah, that to me was the fascinating part, and also compared to last year, and I'm assuming, and I'll see a lot of my counterparts next week, and I'm gonna ask them why didn't you input your data? So I'm curious where they are, or I'm curious if they're having the same conversation with their legislators that I'm currently having as well. Worst case scenario, scary part, and I heard this last week, was a gentleman who was in for 10 years in a facility, and it ended up costing the county about $10 million.
10 years?
Yeah.
Wow.
They were there for 10 years. How that slipped through the cracks and what happened, but 10 million. There, one county, they didn't put the information in here, but they stated that their, basically their budget, specifically for 730s, is 6 million. And I was like, that's pretty intense, so.
This is our portion after insurance, right?
No, that's the part that we're trying to lobby also, because it used to be 50-50 between us and the state. The state said, okay, it's 100% on you now, on the county. So what we're trying to lobby, can we at least have the insurance? When can we activate it? At least after 30 days, or so that's something we're lobbying with Department of Health to see if we can do that. But right now, no insurance at all. That would help.
Yeah.
You said you talked with the state representatives. What'd they have to say? We hear the complaint, and
They actually, what they told us is to let you guys know, and most definitely let our state representatives know for Chautauqua County, our state senators, because this has been a hot topic of conversation. This and bail reform has been the two real hot topics of conversations in terms of the 730s and in terms of the how they have gone up drastically. They mentioned the beds being an issue in terms of for your 939 hospitals and the amount of beds, and how Hochul did put in the plan to open up new beds and have hospitals open up new beds. Buffalo Psych, I know, opened up 12 new beds, but those are going to fill up pretty quickly, and we know this. They did bring up the fact of bail reform. So it's, I hate to say it, but like a political game when it comes to this piece, and it's like they have to go. It's not that they have to go somewhere, but if you, with fentanyl, with substance use, with not being in your right faculties, especially when you're coming in and you don't incarcerated individual, it's kind of challenging to partake in your own defense, and it's just really trying to get creative in the sense of how long do we wait to get them sober, or to see if they can sober up, get them on the right medications while they're in the jail through the medication assisted treatment program. And it's like which robbing from Peter to pay Paul in what sense, and where do we get it from? I mean, we did very well in the sense of as a team in the amount of people. So we've been able to catch a lot of these and keep it in the county, which is a good thing. The stays is what killed us, if I'm gonna be honest. The length of stay has, I think all four of these gentlemen have been there pretty much the whole year almost. And the young man too. The young man has been there since March.
And this is the restoration piece you're hoping
Yes.
to change?
Yes. Hoping we could come together and have a better I think conversation from the legal perspective, because I understand with the judges as well. What happens if we let a person out because of bail reform? We hope they go to the outpatient appointments, and we hope they do the right thing, but God forbid they end up hurting someone or hurting themselves. Now what? Now how does that look on our end? And then the other piece is, yes, we want to help them and we want to get them into the right place and get them the right treatment, but is setting them up there for a year going to really help this person? And that's the question and the dilemma that we currently find ourselves in.
So the one individual that 70+ thousand is just under a year?
Yeah, just under a year, and that's actually a youth.
Wow.
That's actually a youth. And believe it or not, and the reason I remember this case is because we fought for a whole week to help get this youth placed because we had nowhere to place him. And we were lucky enough to get him in the proper setting. And then we got the bill.
Yes, Dan?
You're using full fund balance. No other place to get any funds for this? You've used all your vacancy savings or, throughout the year?
Yeah, and the where it gets tricky with this one is they don't want us to use revenue to pay it. It's like they want the county to pay 100% of it, which is fascinating to me. So it's like can't use revenue, can't use grant funds, and it's like how can we like try to help to mitigate this? And like oh, it's on the county. So it's just. It's why I want to have more further conversations with the state and really provide some real clarity on it. And it's one of those. So I think the best example I can give is with the medication assisted treatment that happened in the jail. Here's this program, go start it, get it up and running. And when it started, they only gave us, I think, maybe $100,000. And that went towards medication, and that was it. That wasn't towards FTEs. That wasn't towards anything else. And there hasn't been no further conversation or dialogue. How can we make this program sustainable and feasible long term, especially when there's no insurance in the jail that we could turn on?
Any other questions? I don't want to say concerns, because,
We have lots of those.
yeah. All in favor?
Aye.
Aye.
Okay.
I'll
Thank
come
you.
back with an update.
Okay, this brings us to any other
Thank you.
discussions. Anything else? Is there a motion to adjourn?
So moved.
Second? All in favor?
Aye.
Aye.
Okay, we are adjourned.